If you are past the age of 60 and you take vitamin B12 every single day, pause and listen closely. This is a concern I hear again and again in my clinic. Patients often tell me, "Doctor, I never miss my B12. So why do I still feel exhausted, lightheaded, mentally slow, or notice tingling in my hands and feet?" Not long ago, a 68-year-old man came to see me with exactly those complaints. He had been supplementing with vitamin B12 for over 7 years. His lab work showed levels within the normal range, yet his stamina was fading, his balance felt unstable, and his memory was slipping. The surprising truth was not that he lacked B12, it was that he was using it incorrectly. Recent scientific findings reveal that a very common mistake with B12, especially among adults over 60, can interfere with proper absorption and quietly harm nerve function over time. I am Dr. Emily Carter, and in this video, I will walk you through what that mistake is, why it is frequently missed in routine care, and how to take vitamin B12 properly, so it truly benefits your brain nervous system and long-term energy levels. Many people assume that if their blood test shows a normal B12 value, there is nothing to worry about. However, in older adults, that conclusion can be misleading. Vitamin B12 plays a critical role in maintaining healthy nerves, supporting cognitive function, forming red blood cells, and sustaining energy production. When the body does not have enough active B12 available to the cells, the nervous system begins to struggle. Early warning signs often include numbness or tingling in the extremities, problems with balance, persistent fatigue, forgetfulness, and mental fog. The challenge becomes more pronounced with age. After 60, the body's ability to absorb vitamin B12 declines significantly. More than half of adults in this age group produce less stomach acid than they once did. Adequate stomach acid is necessary to release B12 from food and many supplements. Without it, much of the vitamins simply passes through the digestive system without being utilized. I witnessed this with a 71-year-old patient named Margaret. She reported a burning sensation in her feet and frequent spells of dizziness. Her physician ordered a B12 test, which returned a value of 420, technically within the normal range. She was reassured that everything looked fine, yet her symptoms continued to worsen. What often goes unrecognized is that a standard serum B12 test measures the amount circulating in the bloodstream, not the amount that is actually being absorbed into and used by the cells. In older adults, blood levels can appear adequate while the nerves remain deprived. This explains why so many seniors faithfully take vitamin B12 for years without noticing any real improvement in how they feel. The first major mistake. This is where the first big mistake usually happens. Many older adults take vitamin B12 as a regular pill, swallow it with a sip of water, and expect it to work the same way as other vitamins. But after age 60, that approach often falls short. Here is why. Proper B12 absorption depends on a stomach-made protein called intrinsic factor. As we get older, the stomach may produce less of it. When intrinsic factor is reduced, standard swallowed. B12 tablets may not be absorbed well, even if the dose looks correct on the label. This is not an unusual problem. It is incredibly widespread. The 68-year-old man I mentioned earlier did everything right on paper. He took the same brand, the same amount every morning, and still his nerve-related symptoms continued to progress. The turning point was not increasing the dose. It was changing the delivery method. Once we adjusted the form of B12, improvement began within a matter of weeks. That is why how you take B12 can matter just as much as how much you take. If this is making sense so far, tap the like button. It helps the channel reach more older adults who truly need this kind of guidance. The second mistake. Now for the second mistake, and it may be even more common. Many people choose the least helpful type of B12 without realizing it. Take a quick look at the ingredient label on most B12 bottles in stores, and you will keep seeing the same word, cyanocobalamin. It is inexpensive, it stores well, and for many seniors, it is not the best option. Cyanocobalamin is a manufactured version of B12 that must be converted into active B12 before the body can actually use it. That conversion relies on strong liver support, efficient enzymes, and adequate antioxidant function. In adults over 60, those conversion steps can slow down, which means you may be taking B12 consistently, but not benefiting from it the way you expect. I saw this pattern with a patient named Robert, age 72. He had used cyanocobalamin for years. His lab results looked fine, yet he still dealt with numb fingertips and trouble with walking. When we switched him to methylcobalamin, an active form of B12, the difference was clear. After about 1 month, his balance felt steadier. By 3 months, the numbness had eased dramatically. Studies also suggest that active forms such as methylcobalamin and adenosylcobalamin tend to be absorbed and used more effectively in older adults. The third mistake. A third problem is often about timing. Many older adults take B12 once in the morning and assume that one dose covers the entire day. But vitamin B12 is water-soluble, and the body clears it relatively quickly. For people who already struggle with absorption, a single daily dose may not maintain steady availability long enough to support ongoing nerve repair. There is also confusion about injections. Some seniors assume B12 shots are the only answer. The truth is more nuanced. Injections can be very useful in cases of severe deficiency, but they are not automatically required for everyone. For many older adults, a well-made sublingual B12 taken the right way can work just as effectively. Sublingual B12 is absorbed through the tissues in the mouth, which helps it bypass the stomach and the need for intrinsic factor. This matters even more for people with low stomach acid or chronic digestive issues. Here is the takeaway. If you're over 60, swallowing a typical B12 tablet may help your lab numbers look normal, yet still fail to fully protect your nerves. What surprises many seniors is that this third mistake is not only about dose or product choice. It is also about consistency. A lot of people use B12 only when they feel drained. They take it for a few days, skip days, stop when they feel better, then restart weeks later. Nerve tissue does not recover well under that pattern. Vitamin B12 is not a quick pick-me-up. It supports repair. Your nerves need reliable day-to-day access to B12 to rebuild myelin, the protective layer that insulates nerve fibers. On and off use can disrupt that rebuilding process. I saw this clearly in a patient named Elaine, age 70. She only took B12 on days when she felt unusually fatigued. She would notice a small boost, but her tingling balance problems and memory concerns never truly improved. Once she began taking B12 consistently, without skipping, her symptoms started to stabilize. After about 2 months, the tingling stopped getting worse. By the 4th month, her balance had improved. Another detail people overlook is taking B12 too late in the day. Many seniors take it at night, and for some individuals that can disturb sleep. Poor sleep can raise cortisol, increase inflammation, and slow the body's repair work. For most older adults, B12 is best taken earlier, usually in the morning or early afternoon, so it supports daytime energy without interfering with nighttime rest. Hydration plays a bigger role than most people realize. B12 functions inside cells, and healthy cells depend on proper fluid balance. Mild chronic dehydration, which is common in older adults, can reduce nutrient transport into nerve tissue. If you take B12 but rarely drink water, your results may remain limited. Finally, certain medications can reduce B12 absorption or interfere with how it functions. Common examples include acid-reducing drugs, metformin, and some antibiotics. This does not mean you should stop prescribed medication. It means you may need to adjust how you support your B12 status while continuing your treatment plan. By now, one point should be clear. Most seniors are not making just one mistake. They are making several small ones at the same time. Each one reduces the benefit a little, and together they can drastically weaken the results you expect from vitamin B12. The correct vitamin B12 protocol for seniors. Now, I want to lay out a practical B12 plan for adults over 60. This is the same framework I use with my own patients. Start with the form. In most seniors, the most reliable options are methylcobalamin or a blend that includes both methylcobalamin and adenosylcobalamin. These are active forms of B12, meaning the body can put them to work right away. If you are depending only on cyanocobalamin, especially while experiencing nerve-related symptoms, you may not be getting the support you need. Next is the delivery method, and it matters more than many people think. After 60 simply swallowing a basic B12 tablet often produces disappointing results. A sublingual B12 that dissolves slowly under the tongue can bypass several common absorption obstacles. For many seniors, this change alone can make a major difference. Now, let's talk about dosage. When the goal is brain and nerve support in older adults, very small doses frequently fall short. Many seniors require higher amounts to overcome absorption limitations. A commonly effective daily range is 1,000 to 2,000 micrograms. Some people do better starting higher and then reducing to a maintenance level later. This approach is generally well tolerated because B12 is water-soluble and extra amounts are eliminated through the body. Consistency is the next non-negotiable. B12 should be taken every day, not only on low-energy days. Nerve healing takes time, and progress is usually gradual. Improvements often appear over weeks and months rather than immediately. Timing also plays a role. For most older adults, B12 is best taken earlier in the day, such as in the morning or early afternoon. This supports daytime energy and lowers the chance of sleep disruption. If you notice B12 makes you feel more alert, avoid taking it late in the evening. Supportive nutrients come next. Vitamin B12 does not operate in isolation. Folate and vitamin B6 are often needed to fully support nerve health. At the same time, be careful with high-dose folic acid. Many people tolerate natural folate sources or methylfolate more comfortably. Finally, monitor progress the right way. Do not evaluate your results only by a lab number. Track real-world changes. Is the numbness easing? Is your balance steadier? Is your thinking sharper? Those functional improvements can be more meaningful than a normal value on a blood report. One of my patients aged 75 followed this exact protocol. After 3 months, her lab levels moved only a little, but her walking became steadier. She stopped falling and her confidence returned. That is what true progress looks like. When vitamin B12 alone is not enough. By this stage, there is one reality every senior needs to understand. Vitamin B12 can be incredibly helpful, but it is not a miracle cure. In some cases, B12 by itself will not completely eliminate symptoms, even when you take it correctly. One common reason is long-term nerve injury. If someone has lived for years with nerve compression, spinal wear and tear, or diabetes-related damage, B12 may help support the healing process, but it cannot instantly undo serious structural problems. Blood sugar is another major piece of the puzzle that often gets missed. Elevated glucose can injure nerves directly. For older adults with prediabetes or diabetes, tingling numbness and burning sensations may continue unless blood sugar is brought under better control. Inflammation can also reduce results. Ongoing inflammation disrupts nerve signaling and makes it harder for nutrients to reach nerve tissue efficiently. Lack of sleep, constant stress, and sitting too much can all push inflammatory markers higher. When those drivers remain unchanged, B12 has to work against a stronger headwind, and the benefits can feel limited. Misdiagnosis is another risk. Not every episode of numbness, pins and needles, or weakness comes from B12 issues. Cervical spine compression carpal tunnel syndrome and other forms of peripheral neuropathy can look very similar. That is why symptoms that persist, worsen, or spread should be assessed by a medical professional. More supplements are not always the answer. Let me give you a quick example. A 73-year-old man came to see me feeling discouraged. After reading advice online, he had doubled his B12 dose on his own, yet nothing improved. When we evaluated him more thoroughly, we discovered spinal stenosis. His nerves were being physically squeezed, and no amount of B12 could correct that. Once we identified the real cause and began appropriate treatment, B12 became a helpful support instead of an ongoing disappointment. Let's pull everything into a simple, practical action plan. If you're over 60 and you're taking vitamin B12, these are the points that truly make the difference. First, do not rely on lab numbers alone. A normal blood B12 result does not automatically mean your nerves and brain are getting what they need. Track real changes in your body over time and take your symptoms seriously. Second, select the right form. Use an active B12 such as methylcobalamin or a formula that combines methylcobalamin with adenosylcobalamin. These options do not depend heavily on conversion and tend to perform better in older adults. Third, pay attention to how you take it. If you are over 60, depending only on swallowed tablets is often a weak strategy. Sublingual B12 can absorb through oral tissues without relying as much on stomach acid or intrinsic factor, which is exactly where many seniors run into trouble. Fourth, use a dose that can actually overcome absorption barriers. For many seniors, a reasonable starting range is 1,000 to 2,000 micrograms per day. Some people benefit from a higher amount early on and a lower maintenance amount later. If you feel unsure, work with your doctor. Fifth, stay consistent. Take B12 daily. Nerve recovery is slow and gradual, and skipping doses can interrupt that steady repair process. Sixth, choose a timing that supports your body. Morning or early afternoon is the best fit for most older adults. If you notice B12 makes you feel more alert, avoid taking it late at night so it does not interfere with sleep. Seventh, strengthen the conditions that allow B12 to do its job. Hydration matters. Blood sugar control matters. Sleep and stress management matter. These factors influence inflammation circulation and nutrient delivery, which determines whether B12 can effectively reach nerve and brain tissue. Eighth, know when to investigate further. If symptoms keep progressing, do not assume B12 is the only explanation. Seek proper evaluation to rule out nerve compression, metabolic problems, or other underlying causes. I want to be very clear. When vitamin B12 is used correctly, it can protect nerve function, support memory, and improve energy for many seniors. When it is used poorly, it can look like it does nothing at all. That difference is not luck. It is understanding the process. Before we close, I want to leave you with one final story. A woman in her early 70s came to see me after years of believing B12 simply didn't work for her. When we reviewed her routine, none of it sounded outrageous on the surface, but the details were working against her. She had the wrong form. She was swallowing a tablet her body struggled to absorb. She took it inconsistently, and she judged progress only by lab values. She adjusted just a few things: the form, the delivery method, and the daily consistency. 3 months later, she told me something I still remember clearly. She said, "I feel stable again. I trust my feet when I walk. I don't lose my words in the middle of a sentence anymore." That is the difference between taking a supplement and using it properly. If you are over 60, vitamin B12 is not something to treat casually, but the way you take it matters more than most people realize. Tonight, look at your current routine and ask yourself one honest question. Is this truly supporting my nerves and brain, or am I simply going through the motions? If you're over 60, vitamin B12 can be one of the most important nutrients for protecting your nerves, supporting memory, and restoring steady energy, but only if you use it the right way. So, tonight, take 1 minute and look at your routine. Are you choosing an active form? Are you using a method your body can actually absorb? Are you taking it consistently at the right time while supporting your sleep, hydration, and blood sugar? Because the goal isn't just to take a supplement. The goal is to help your brain and nerves stay strong for the years ahead. And remember, if your symptoms are getting worse, don't guess. Get properly evaluated so you're not treating the wrong problem. If this video helped you, please tap the like button and subscribe to the channel for more clear science-based health guidance for life after 60. I post new videos every week to help you protect your brain, strengthen your body, and feel confident in your health decisions. Also, leave a comment below with your age and whether you're currently taking B12. Your story might help someone else realize they're not alone.